shoulder instability tests, apprehension test, anterior instability, instruction to patient. I'm going to move your arm into this position. Let me know if you feel pain or a sense of your shoulder slipping out. Procedure. Patient lies supine. Examiner abducts the shoulder to 90 degrees and slowly externally rotates it. Positive sign. Apprehension, fear, or resistance by the patient, more than pain. Indication. Anterior shoulder instability. Next is relocation test. Job relocation. Instruction to patient. I will press gently on your shoulder while holding your arm here. Tell me if your discomfort improves. Procedure. After a positive apprehension test, examiner applies posterior pressure on the humeral head while maintaining abduction and external rotation. Positive sign. Decrease in apprehension or pain. Indication. Confirms anterior instability. Next is anterior drawer test instruction to patient. Relax your arm. I will gently move the shoulder forward. Procedure. Patient supine. Examiner stabilizes scapula and applies anterior translation of the humeral head with shoulder in mid-range abduction. Positive sign. Increased anterior translation compared to opposite side, with or without pain. Indication. Anterior shoulder instability. Next is posterior drawer test. Instruction to patient. Relax your arm. I will gently push your shoulder backward. Procedure. Patient supine, shoulder flexed to 90 degrees, elbow flexed. Examiner stabilizes scapula and applies posterior force on humeral head. Positive sign, excessive posterior translation, clunk or apprehension. Indication, posterior instability. Next is sulcus sign. Instruction to patient. Let your arm relax completely while I pull it down gently. Procedure. Patient seated. Examiner grasps elbow or wrist and applies downward traction. Positive sign, visible or palpable sulcus, gap below acromion. Indication, inferior instability or laxity. Next is load and shift test instruction. To patient, I'll be gently shifting your shoulder joint forward and backward. Stay relaxed. Procedure, patient seated. Examiner stabilizes scapula with one hand and grasps humeral head with the other. Loads the humeral head into glenoid, then shifts anteriorly and posteriorly. Positive sign. Excessive movement compared to opposite side with or without symptoms. Indication. Generalized shoulder laxity or instability. Make infographic of these.